To us, evidence-based practice means constantly reevaluating current practices and using the latest technology and innovation to update best practice guidelines, thus improving health outcomes for Canadians. One Canadian has a cardiac arrest every 13 minutes. Most of these happen without warning in places outside of the hospital. Although most common in older adults, people of any age can experience cardiac arrest. So you might be asking, how do we best tackle this issue? Well, the answer to that has changed over time, but let's show you. Let's go back to 1990. If someone had a cardiac arrest in public, that individual would ideally receive CPR by a trained individual during the average 11-minute wait for EMS personnel to arrive, who would administer an initial shock. Unfortunately, every minute of waiting for defibrillation decreases survival outcome by 10%. In the early 1990s, the American Heart Association began recommending that automated external defibrillators, or AEDs, become available in public places. So let's skip ahead to 2016. Nowadays, a combination of compressions and AEDs are best practice and growing increasingly common in public places. AEDs work by analyzing the patient's heart rhythm and then delivering a shock to the heart when needed, resetting the electrical conduction. Shockable rhythms include ventricular tachycardia, ventricular fibrillation, and supraventricular tachycardia. Rapid intervention with CPR and early defibrillation have been shown to drastically improve survival rates by 50% for out-of-hospital cardiac arrests. AEDs specifically have been associated with better survival rates. For this reason, the Public Health Agency of Canada funded $10 million to the federal AED program for arenas and recreation centers, which allowed for the installation of over 3,200 AEDs across the country and training for over 25,000 Canadians. Speaking of training, while it is ideal to have as many Canadians as possible trained to use AEDs and perform CPR, AEDs are designed to be used by anyone, trained or not. Currently, Canada doesn't have any federal law or policy surrounding the need for AEDs. Manitoba is the only province with a law requiring their presence in public places, while some provinces, like Alberta, have a registry for AEDs. These are important because they allow 911 operators to direct bystanders to the closest AED, minimizing those critical minutes that patients wait for defibrillation. With that being said, let's skip ahead to what we hope will be the reality in 2040. Ideally, AED technology will have continued to improve, making units more compact and even less costly. Maybe an AED app for a phone. AEDs will be more common in private spaces such as family homes and businesses. We expect that the Government of Canada will have created a national policy for provinces to govern the presence of AEDs in public areas and enforce the registration of all AEDs so that emergency services can efficiently direct bystanders in need. Take a minute to think about how commonplace fire extinguishers are due to Canadian laws. There are multiple in any given public building and are often found in private residence. Imagine the impact of having a single AED in every building. Evidence has shown that AEDs improve health outcomes following cardiac arrest. Better access to AEDs will improve public safety, period. Therefore, further research and advocacy to increase AED availability and accessibility throughout Canada is needed. After all, in the next 13 minutes, someone you love could be affected.